Are you trying to understand Medicare? Today we're going to talk about another part of Medicare, Medicare Part D. We're Michael and Shannon, the founders of Healthcare Genius. We're here to give you information on everything retirement and healthcare. Subscribe to our channel and click on the bell for updated videos.
So first of all, what is Medicare? It is essentially the national healthcare program for folks in the U.S. that are 65 and above, with a couple of exceptions. There are 4 parts, Parts A and B, which are also known as Original Medicare, Part C, or Medicare Advantage plans, and then Part D, which is what we're going to talk about, which is for prescription drug plans. Now, if you haven't already, check out our other videos on Original Medicare and on Medicare Advantage, and it'll help you understand what we're about to talk about a little bit better.
So what does Part D cover, prescription drug coverage? Well, when you were working at your employer, or if you had individual health insurance, you probably had prescription drug coverage built into your medical plan. What happens when you retire and go on Medicare is you have a couple of choices. One is you can choose a Medicare Advantage plan, and again, look at one of our videos where we talk about Medicare Advantage plans. And a lot of times the prescription drug coverage is built into those plans. But if you choose a Medicare supplement or a Medigap plan, then you won't have coverage for Part D prescription drugs. So you'll need to buy a standalone plan. So there's lots of options there for you. It's all dependent on what your drugs are, the drugs that you take. MEDICARE.GOV does a good job of giving you some information on where you can put all of your drugs that you're taking with your dosage and the names of the drugs and how often you take it. You can put that into their database, and then it'll actually tell you which plans are the best fit for you. Typically, you're going to see some different copays. You'll have generic copays for those drugs that are generics, and then you'll have brand name and specialty copays for some of the more expensive drugs.
Mike, can you tell us a little bit more about what's kind of the history behind Part D? You know, a lot of us thought that Original Medicare was all we needed, and then it wasn't. So what's the backstory there?
Yeah, great question, Shannon. So in 2006, the Bush administration passed the Medicare Part D program as a way to help seniors really do a better job of affording their prescriptions, because obviously they were getting more expensive, and that was a big sticking point for seniors. At the time, the donut hole was impacting a lot of people, and Shannon will talk a little bit about that. So they came out with this prescription drug program. It's been a great benefit for a lot of seniors. There are a couple of things that people need to be aware of when it comes to Part D drugs. You should sign up when you're eligible. If you don't sign up, there can be a penalty. Typically, that's 1% a month of the standard Part D premium. Today, that's probably about 32 cents a month that you would pay extra based on that premium. But it can add up if you wait 2 or 3 years to sign up. We actually had a client of ours who doesn't really take many prescriptions, and he said, you know, when he turned 65, he's like, why am I paying for a Part D plan? And we said, well, you're paying for it because if you don't sign up, the penalties really add up, and they're for life.
Yep.
So it isn't like they're a penalty for a month or a year. They actually are for the lifetime of the time that you have the Part D coverage.
So as Michael mentioned, there are going to be a lot of different options when it comes to your different drug plans that you'll have to choose from. Comment below and let us know what your needs are and what's important to you. I am going to talk a little bit about the donut hole, but before we do that, let's take a step back and talk about cost of the Part D Medicare plan in general. The first thing that we want to touch on is premiums. As we talked about in our other videos, now we know Medicare is not free.
It's not free?
It's not free. And there's a premium, a monthly premium that you pay if you want to sign up for Part D. The premium consists of a couple different things. The first thing is dependent on your plan. So whatever plan you choose, it's going to have a different premium associated with that plan. And then the second piece of it is about your income. So on top of your plan's premium, if you make more than a certain amount of money per year, in 2019 that's $85,000, then there are different tiers where the more money that you make, the more you'll have to pay for your Part D plan. So the premium that goes directly to the plan, and then the premium that you pay on the premium, so the additional amount that's based on your income, that amount actually doesn't go to your plan, it goes straight to Medicare.
Yeah, that's what we call the punch in the gut tax. That's another one that we mentioned in our Part B video, the punch in the gut tax and what those premiums are. Part D also has a surcharge that you have to pay for making over a certain income in retirement.
That's right, and historically that surcharge, ever since it was put in place in 2007, it's increased year by year. Every tier has increased, and so that's something that whether you're retiring tomorrow or whether you're retiring in 40 years, it's something that you should be thinking about and that you should know about.
Just as an example, we have a client that signed up for Medicare when he first became eligible at 65, and his premium for the Part D penalty was over $70 a month. So it was significant. When you added that onto his premium for Part B with the penalty, his Part B and Part D plans were about $500 a month that he was paying out of his Social Security check.
So once you've paid your monthly premium, unfortunately, that's not all that you pay. There are other costs that are associated with Medicare Part D and with your prescription drugs, and they are, unfortunately, very confusing. So we're going to just walk through one example of what your standard base Part D plan looks like. Keep in mind, there are different plans that you can think of as upgraded or a little bit different, but this is really the baseline plan that we're going to go through. The first piece of that is a deductible. And for that standard plan, the deductible is $435. And what that means is for the drugs that you purchase, before insurance kicks in, before your Medicare plan kicks in, you'll have to pay $435 out of pocket. So whether you hit that on 1 month of drug spend or 9 months of drug spend, before the plan kicks in, that's what you have to pay out of pocket.
And Shannon, I just want to point out, these are hot off the press numbers for 2020.
After you hit your deductible, there is a copay. So every single prescription, every single drug that you buy, there will be an amount that you pay, which is generally a small amount in this phase, and then the rest of that cost is covered by the plan. Now, once your out-of-pocket cost, so your deductible and your copay, and what the plan has contributed, once that total number hits $4,020, that's what we call the initial coverage limit, and that's when you'll enter the coverage gap, or what is also known as, what we mentioned before, the donut hole. So between $4,020 and the next tier, you will pay, now to get out of the donut hole, you have to hit an out-of-pocket cost of $6,350. And that's just what you pay out of pocket. That's not what the plan pays. Once you get out of the donut hole, the last phase is where generic drugs, you pay $3.60. Insurance covers the rest. And for everything else, so specialty drugs, for example, you pay $8.90 and insurance covers the rest.
Boy, Shannon, you're not kidding when you say that's complicated. I think I need a PhD to figure that out, right?
Right? It is complicated, unfortunately. That Medicare site that you mentioned, Michael, is a great resource. I always say the number one thing that you need to do is figure out what drugs are you taking. Start there and choose your plan based on what you need, and then you can figure out the financials.
And the great thing about the drug plans, Shannon, is that you can change those on an annual basis. So when you come to open enrollment, you can make those changes for January 1. Sometimes you actually have other periods too, but if you find that a plan isn't working for you, you're not locked into that forever. So
that's right. Or if you have some kind of diagnosis that's new where you need different drugs, you can change that the following year.
One other thing just to be aware of, if you're still working, every year your employer or your union should be sending you what's called a credible coverage letter, which just talks about how your employer plan compares to the Medicare Part D standard plan that Shannon just walked through.
Yep, and that's for people that are 65 or older that are still working, which, as we know, is a big part of the population.
Right. And just know that penalty, that 1% a month, if you didn't have credible coverage and sign up for Medicare Part D coverage when you were eligible, there can be an impact there. But if you kind of are questioning, why did I get this letter? What does it mean? That's essentially what it's doing. So when you're eligible to sign up, again, U.S. citizen, age 65. There are a couple of other exceptions when you have serious illnesses like end-stage renal disease or Lou Gehrig's disease or ALS, or if you're on Social Security disability, then sometimes you'll qualify earlier than age 65, but for most people, that's when you begin to be eligible for coverage.
Yep. What we really want to hammer in here is that it is really important to have some kind of drug coverage. So whether it's a part of a Medicare Advantage plan or whether it's a standalone Part D plan, we've all seen the news lately. Drug prices can be insane, and so it's really important to have some type of coverage. Original Medicare is simply not enough. So whether you are ready to sign up for Medicare and you want to know your options, or if you're planning for the future and you want to start saving now, if you want to become our client, we're happy to help you with all of your needs, Medicare related and healthcare related. So feel free to go to our description, click on the link, and apply to become our client. And make sure to subscribe to our channel, like our videos, and click the bell to be notified when we come out with new content.